Hi everyone, welcome to ATTR 691. Today we're going to be talking about educational research and the different types of educational research and how to do it. First, I want to lay a little disclaimer about this lecture and about educational research. First, I am not an expert in educational research design. Okay, it's an ever expanding research area, and with several different designs within it, and it really answers important questions, particularly with a lot of our educational reforms and educational changes that are happening right now, and the new emphasis on continuing education. Uh, in this module, with the readings and with this lecture, I'm going to provide an overview of the major types of educational research. And I present 4 or 5 major subsections. However, there are specialty subsections within each of these. And to be quite honest with you, uh, I don't have the breadth of knowledge to make sure that I cover every single one of those. Um, but you will get an understanding for the major sections and and how they all interact with one another, and where if you are doing educational research, where this subsection or where your specialty section would fit within these major sections of educational research. Also, I don't know, some of you may have heard me, and some of you may have not have heard me. I think sometimes I joke about educational research, about how it's not quote unquote real research. Um, but I 100% believe and I advocate that educational research is real, it's valuable, and it's important. Uh, and we'll talk about that perception by different types of researchers, by laboratory researchers particularly, that an education research is somehow less uh, than uh, than laboratory research. But I disagree, and I want all of you to have the respect that educational research deserves. And we'll actually talk about an example at the end when someone thinks they know about educational research and they don't, and it creates some issues. So, from the surface, educational research looks different than clinical or experimental research. And actually, I would almost argue that most, I would say, clinical or laboratory research, um, because educational research oftentimes is experimental in nature, because they're testing a hypothesis or they're observing an effect on something. Um, and why it looks different is because it involves students and teachers, and the teacher may also be, or the instructor may also be, the researcher. And oftentimes it examines both perception, confidence, as well as reality. So asking someone how confident they are in answering a question, and then actually asking them a question that tests their knowledge. And so you have the reality of testing their actual knowledge using some sort of test question, and you have their perception or their confidence using a confidence questionnaire. However, when we think about this, and what I really need you guys to focus on and understand, is that educational research follows the same set of rules as laboratory research or clinical research. And the same issues exist, and the same things that we want to have good in experimental research, we want to have good in educational research. And types of things such as measures and methods should be valid and reliable. So if you develop methods or you develop different measurements, you need to make sure they're valid. You need to make sure they're reliable. You need to make sure that that they follow all the rules, that you're not just making it up. Also, you need to make sure that the designs that you choose with educational research produce both internally and externally valid results. And, just because we categorize something as educational research doesn't mean it's not a different category that we've already talked about. Many educational research design are observational in nature, where you're observing a phenomenon without really any intervention. And some of them we also have some quasi-experimental designs, which also fall into experimental research, educational research. So there is a lot of overlay here. Um, but the difference is that we're using students and we're using learners, and sometimes the instructor is also the researcher, which creates some perceived problems. I wouldn't say they're real problems. And also, the educational research follows the exact same statistical analyses as other research designs, whether you use qualitative or quantitative. It's not like there's a special subsection of educational research statistical analyses. You may use a dependent t-test to study the effects of caffeine on vertical jump height, and you can also use a dependent t-test to understand the effects of case studies on student performance on the VOC exam. Right? It's different questions. One's educational research design, one is, I would say, quasi-experimental design, but they both use a dependent t-test comparing two means. Now, oftentimes in educational research, you have more non-parametric data analysis due to sample discrepancies, and that's all I'll say about that. Because that's not for this class. You have a statistics class, and you hopefully will talk about the differences between parametric data and non-parametric data, and the assumptions that you have to have for each, and the different types of analyses you have to run, depending on if your data is parametric or non-parametric. But again, that's not for this class, that's for your statistics class. So, as I mentioned earlier in this lecture, we have four common subsections. And these are learning and learning styles, instructional methods, clinical instruction, program administration. I'm going to go through each of these and hopefully try to provide you an example, but lay out the main types of questions that each of these sub designs or sub areas aim to answer. The first subsection is learning and learning styles. This subsection or subtopic of educational research really aims to identify the differences in learning styles and how teachers can take advantage of those styles using different techniques, or using different teaching techniques to take advantage of this different learning styles. So if you're a kinesthetic learner, which means you like to learn using movement, or are you an audio learner where you like to learn because you can listen, or are you a visual learner so you like to learn by reading? How as a teacher can you use different instructional or pedagogical techniques in order to help your students learn? Now, I think this is crucial. Educational research is not only confined to professional and post-professional or pre-professional education. Okay, we as practicing athletic trainers, learn as well. We attend continuing education conferences. We attend all sorts of things that professional development that are supposed to enhance our knowledge. And so all of these categories apply to continuing education as well. So don't think that, I only want to study athletic practice and athletic trainer, so educational research is not for me. That is absolutely incorrect. Many athletic trainers, many athletic training studies, particularly educational studies, are focused on continuing education. And again, learning and learning styles, as I mentioned, with practice and athletic trainers, actual knowledge versus perceived knowledge. I talked about that with an example in terms of what your students think they know versus what they actually know. And we do the same thing with our practicing clinicians. And what we found in a lot of Dr. Everman's research and a couple of our doctoral students' research has been focused on this. And what we know is that athletic trainers think they know a lot about common things like airway adjuncts or spine boarding or knee injuries. And in reality, they don't know anything about it. So they would essentially fail a test. They think they know a lot of information, but then when you give them a test, they fail the test with baseline information that's needed to do the skill. So that's kind of a summary of the learning and learning style subsection. The next one is instructional method. This is a broad area And it generally refers to classroom teaching, not so much clinical teaching. But the goal of this is to identify teaching methods which are the most effective for learning for all students. So if you have senior level athletic training students, what is the best way to teach them? Is the best way to teach them by giving them the book and say, okay, so for the BSc exam, is the best way to teach them by babying them? Is the best way to teach them by doing a mix? Is the best way to teach them kind of throwing them in the fire and seeing what happens? And you know, or for example, for you all in the DAT, what's the best way to teach post-professional athletic training students in a distance hybrid program? Is it best just to give them a bunch of readings? Is it best to give them lectures like I do with you? Is it best to do a mix? Should you incorporate DAT weekends like we do at Indiana State, or should you follow a model like Idaho uses, where they come one time for a month, and that's all their clinical, or that's all their in face-to-face experience? Or do you do a model like AT Still, where you come 1 week throughout your entire program, and it's not cohort based? You know, that's a really important question that we're trying to figure out right now in athletic training, particularly doctoral athletic training programs. We're not even to the point where we can figure it out because there's not enough data. But if we look at other professions, a lot of people aren't really studying that right now. Like, what is the best way to learn for an adult learner who's studying post-professionally? You know, do we just literally? I don't know what the best way to do it is. And I'm sure you all have your preferences based on your experiences so far in our program. There are probably some weeks where you feel like, if I give you a bunch of readings, you're like, I just don't get this material. And you may just prefer me to lecture to you, or so you may be more of an audio learner, or you really get the most out of you're able really to synthesize all the information when you come to the DAT weekend. So maybe you're a kinesthetic learner, or a social learner where you have to be around this group of people, or in clinical class we started out doing discussion boards, but most people didn't like the discussion boards because they didn't feel like they had that social interaction. So we went to the discussion forums using Collaborate. Some of you don't really love that, but for the majority of individuals, you all like that social learning component. And so we don't have any data on whether that works. I'm doing mini studies every week in all of our classes to figure out what works and what doesn't work. That's why Dr. Everman and I really like your feedback, and we really need your feedback, because it helps us guide the best way to teach you all. But this type of educational research from a systematic level or systemic level, we can, from a professional level, this type of research helps us understand what type of student is successful and what type of instructional methods are successful. And again, this goes back to practicing athletic trainers as well, even though it's generally referred to for classroom teaching. If we think of continuing education, how do we best learn at continuing education? Is it through labs? Is it through workshops? Is it through plenary sessions? Is it through informal learning, like peer-to-peer discussions? If you've been to NATA, they do those. Is it through web-based learning? What's the best way to gain our CE? And that's again another topic that we're trying to figure out. The BOC is trying to figure out in terms of how do we keep our clinicians confident. The next one is clinical instruction, and clinical instruction really is the first two categories, with learning and learning styles and teaching methodologies, but applied to the clinical setting. And I just laid out several questions because I feel like that's the best way to describe this type of research, because it's kind of a combination of the first two categories, but applied to clinical experiences. So what are the characteristics what characteristics are beneficial in preceptors and supervisors for student learning? You can either question, are our preceptors qualified or to what extent are preceptors qualified to be teachers? Because most people didn't go into being an athletic trainer to be a teacher, but then you go somewhere that has an education program and you're forced to be a teacher, whether you want to or not. So, how do we know if our preceptors are good teachers, or are our preceptors qualified to even be preceptors? Should they just be athletic trainers and not athletic trainers and preceptors? What makes a preceptor effective? What formats of clinical education are best? So, do you do an immersion where you are similar to med school, where you go and you are fully immersed in athletic training? Do you do a consecutive model where you do all of your coursework in the beginning and then you go out to clinical, but you never see a patient until you've done all of your coursework? Do you do a concurrent model, which is what most places do now, where you do classes in the morning and you do clinical sites in the afternoon? Do you do a mix of concurrent and consecutive with immersion? We really don't know that. There are several models out there, and we can look to other professions to see what the level of success is. But for athletic training, it may be something different. So, that's an area of research. How much do students learn, and how do the students learn at clinical sites or during clinical instruction? Do they learn by watching their preceptor? So if their preceptor doesn't model good professional behavior, are they not going to model good professional behavior? So if their preceptor doesn't wear professional clothes, are they going to think it's appropriate not to wear professional clothes to practice or to games or to work? If their preceptor cusses in the athletic training room, or cusses to their athletes, or cusses to their patients, is the student socialized to learn that bad behavior? Or on the vice versa, let's talk about good things. If the preceptor has good life-work balance, does that transfer to the students? Or is it better to do simulated experience? Or what level of direct supervision is really necessary? And what level of direct supervision keeps the patient safe, but also gives the students a good learning experience? What's the best way to teach clinically? And I think that goes back to my last question. Is the best way to teach standing over your students and watching them do everything? Or is the best way to teach kind of letting them do their own thing and you kind of serve as a consultant at the end? And this has implications for everyone, regardless if you're a preceptor or not. So, and that kind of gets back to part of this program. And I know right now in AT Educator, you guys are learning about all these different teaching methods. And although some of them may be in the context of classroom teaching, everything that you are learning in AT Educator should be transferred. Not it could be, but should be transferred into your clinical teaching. Whether you're teaching your patients, whether you're teaching your colleagues, whether you're teaching students if you have students, whether you're teaching student workers if you have student workers, whether you're teaching external stakeholders, whether you're teaching internal stakeholders, whether you're teaching coaches, whether you're teaching managers, doesn't matter. Those methodologies should be utilized. And like I said, it's not just about being a preceptor. It's not just being like an athletic training educator, if you will, in the strict sense where you're in a classroom teaching. It's about being an advocate for the profession and using teaching techniques to advocate for yourself. That's really the key, and that's where, in terms of our points of distinction, when we talk about athletic training education and leadership, it's about advocacy through education and using evidence-based techniques to help you advocate for yourself, and advocate for your profession, and advocate for your students, and advocate for your coworkers. So this clinical instruction research really applies to everyone, not just those individuals involved with a professional or post-professional program. The last one is program administration. And this really deals with the overall studying what we do as program administrators, director of clinical education coordinators, or program directors. If you look at the literature in this program administration stuff, most of us program administrators throughout the country, we're not trained on being a program administrator. Dr. Everman's a rarity, and same with Dr. Armstrong, is that they went to school to be program administrators, where I didn't go to school to be a program administrator. I went to school to be a researcher. And I didn't really know anything about program administration when I became the director of clinical education. I just had to learn on my own. And if you go throughout the country, most of our educators, at least now, there's been a shift, particularly with the younger athletic training educators who are program directors. There's been a shift to go get some specialized training in administration, program administration specifically, not just organization administration, but program administration. Because what we've seen is that, pre-tenure faculty who may be in their first year and then they get offered this program directorship position, they're not able to handle the load, and then they don't know what happens, and then the program goes downhill, leads to probation, and you also aren't making your own individual professional growth, so then you lose your job, and you have to go find another job, and it's just bad for everyone. So how do we train those individuals? What's the best way do we run a program? This type of program administration research is what led to a lot of the education reform that we have now, with moving to the professional level masters. Because people were, in our programs, and our program administrators were noticing that our students were not able to focus on athletic training because they had chemistry class, and chemistry class trumped athletic training classes, because in our students' perceptions, chemistry or organic chemistry or biology is somehow better than athletic training, which is a fundamental problem for all of us. If students think that a general education or a prerequisite for something else is more important than your major classes, a lot of that came into it. Do you take sophomores? Do you have a secondary admissions process? Do you admit them straight from the get-go? What should your cutoff criteria? Should it be a 2.75 GPA or a 3.0 GPA or a 3.5 GPA? Where, should you have remediation? Should you not have remediation? What should your individual benchmarks be? Etc. There are all sorts of these questions in terms of how do we get the best student and how do we produce the best athletic trainer to protect public safety? And also, how do we organize our experiences to optimize student learning and to maximize student learning? So, is it something where you're a sophomore, you don't see patients at all, or if you're a first-year grad student, you don't see patients at all, and then your second year, you see patients all the time? Do you do some sort of internship? That gets back to that clinical education thing. Do you do standardized patients? Do you not do standardized patients? Do you use simulation? How do you achieve these objectives? Do you essentially test everyone with a BOC style test at the end of every semester? Do you not do that because the BOC exam really doesn't prepare you to be an athletic trainer? It prepares you to not kill anyone. So all these questions are important for program directors and program administrators to ask themselves, and we're trying to answer this question so we can have consistency across the board while still allowing individual programs the autonomy to put their own twist on it, so we kind of have uniqueness, so we're not creating a homogenous group of athletic trainers. Another question is, how many students at a clinical site are best? Should it be one-on-one? Should it be, the BOC or the KD allows us to go, I believe up to 5 or 6 to 1, maybe even 8 to 1, 8 students to 1 preceptor, which is overwhelming. How do you organize your experiences like that? So do you pair a senior student with a sophomore student? Do you pair a second year with a first year? How do you do that? And is there one way that's more beneficial than the other? So those are all questions that we can answer with educational research design as it relates to program administration. So the bottom line, I know I've gotten off topic and I've just talked about some different research questions that are really important to answer, but the bottom line for this is educational research answers some of the most important questions facing the profession today. And I mean the profession, I don't mean education. It answers some of the most important professional questions facing us today. Professional education, post-professional education, and CE. It also answers some of our, educational research. Yeah, it's more policy, a mix of education and policy research, but looking at this idea of paid internships, that is an important issue facing our profession today. And hopefully educational research and policy research will be the light that guides us in the right direction. This type of research is often put down by laboratory researchers because somehow they see that, well, it's not a controlled laboratory setting, so it must not be real. It's soft. You're just making it up. You're getting into touchy-feely stuff, and science shouldn't be touchy-feely. It should be black and white. So there's this underlying rub between educational researchers and non-educational researchers. But I think everyone needs to understand that there's value in all types of research, and your research shouldn't be put down because you focus on one part or the other, because they're all important questions. And I just want to make this point: it should not be viewed as less than something else. No research should be viewed as less than another. Because no approach can answer all the questions, and no approach, except for educational research, can answer all those questions that I just mentioned during this lecture. Period. So you can't run an experimental design, or you can't run a laboratory design to answer the question about, what's the best way that our students learn. You can't. Period. It's unethical to do, and no IRB would ever do it. So we have to have this educational design to do that. So just for fun. And talking about educational research and what happens sometimes when non-educational researchers think they can do educational research. If you don't remember, in 2013, in the middle of this debate on whether we should do the transition or not, the white paper on education had already come out suggesting that we should go forward, but the KD and the BOC, or the KD and the ATTA hadn't made a decision yet. It was in the spring. Dr. Bill Prentice, spring of 13, Dr. Bill Prentice released a survey that was aimed at understanding ATs through the transition, therefore making it a type of educational research because it was based off of what's the best education level we should be at. However, this quickly became an example of what happens when people who don't understand educational research or observational research try to do it. It usually ends up wrong. And it usually ends up, and I think that's honestly why the reason some people have a poor view of educational research is because non-educational researchers are trying to do educational research and they do a bad job at it. And because you have some name like Bill Prentice, it somehow gets published. It somehow holds any weight, even though it was an absolutely horrible thing. So, at this point we had started our blog, and Dr. Everman in the AT4AT blog wrote a response, which was praised by many of the athletic trainers and educators, and the KD and the BOC and the NATA, because it challenged, it essentially called out the problem with non-educational researchers trying to do educational research, and particularly Dr. Prentice's approach. If you haven't read it, I put the link on the lecture that you'll be able to go back and click. Please take a look. It actually, particularly if you're going to do some observational research design or some educational research design, it is really, really helpful because it talks about the key problems that was presented in this study. I don't know if any of you took it, or maybe you can remember. There's a link to the survey up there, so you can probably go back and look. But you can see some of the human subject, or the IRB violations he made, some of the questions, the question responses that were violated, some of the double barrel questions, which essentially lead to bias and it essentially threatens internal and external validity. So make sure you take a look and enjoy that. So with that, that concludes my lecture on educational research. I hope everyone has a great week, and I will talk to you soon.